New research raises more concerns about a troubling side effect of the pandemic, the effect it's having on advanced breast cancer cases here in the U.S. Data from one cancer clinic in California shows that the number of new advanced stage 4 breast cancer cases jumped from 1.9% of all cases in 2019 to 6.2% in 2020. The Biden administration says there have been more than 9.5 million missed cancer screenings in the U.S. because of the pandemic. CBS News medical contributor Dr. David Agus joins us now. Dr. Agus, good morning. That is a big number of missed screenings. How dangerous is it?
Well, 1.7 million people a year are diagnosed with cancer in the United States, and we took a pause on screening, yet disease didn't pause. And so what we're seeing is patients presenting with advanced disease. Advanced disease means that it's no longer curable. And obviously, for each one of those lives, you feel sorry that we dropped the ball there because our hospitals were full and we couldn't do cancer screening. So are preventative screenings down in other types of cancer, or is breast cancer a particular category? It's all of them. Obviously, breast cancer mammography, getting a mammogram, we know will save the life of a woman because it diagnoses cancer early. Colonoscopy, cervical cancer, prostate cancer, skin cancer, all of those we took a pause on, and yet the disease themselves didn't take a pause. And the earlier you catch these, the much more likely they're curable, and we missed that window, unfortunately, in many people.
Yeah, and as we've seen, Dr. Agus, cancer does not discriminate. How often should women get them? When I was coming up, we were told you should get it once a year and you should start at the age of 40. Is that still true? Yeah, it really depends on who you listen to. And so the clear data from U.S. Preventive Task Force that starting at age 50, you can get one every 2 years. Starting at age 40 is really in the hands of the woman based on her family history and her ability to really tolerate risk. I'm recommending everybody get one at age 40. I really think it works and it saves lives. If you have dense breasts, you may need an MRI or a different kind of screening because mammogram won't work in that setting. But it's critically important that we screen women today for breast cancer, catch it early, where it clearly is curable. We're going to save a lot of lives.
Dr. Agus, as we move into a different phase of the pandemic, are preventative screening rates getting back to pre-pandemic levels? For example, I haven't been in 2 years to get a dermatology test to make sure these freckles stay adorable. So I'm doing that next month, but I'm wondering if people are getting back to that level again.
Vlad, you cannot stop. I mean, there's a lot of preventive maintenance
there was a pandemic
onto the United States. I know, but literally, I mean, doctors' offices are remarkable at blocking the virus and about making it safe for people to be there. And when you can imagine, if we deferred millions of screenings, everyone is in line now. And I'm seeing that in my patients, right? They want to get a scan or they want to get a screening, and there's a month delay or there's a 2-month delay. It was before, they could get it in a few days. Everyone be patient, sign up, and get those screenings that were missed. We have to get back on track. We have to focus on health in our country and on prevention more than anything, and we're ready for it, right? We are now safe to go out and get those screenings, go to your doctor, get your bloods drawn that weren't drawn before, get that skin exam, get that GYN exam, that mammogram, or that prostate test, or colonoscopy, get them.
Yeah, good advice. Although, Vlad, I have your chart here, actually, and your freckles are, according to your doctor, adorbs. They did a little
as long as they say that way. I'll find out in a month. Thank you, Dr. Agus, as always. We appreciate it, my friend.